Even though there is an increase about the resources that we can get in order to improve our mental health, like information, advices from professionals, books, trainings, workshops, the ratings of anxiety, depression, suicide, trauma doesn't decrease, but they are increasing in our societies. In terms of logic, this fact is not understandable. Why, if we have more access to information than all ages in history, why we have more problems than before? Why the access of information and resources doesn't solve the problems that we have? The fact that we have more access to information doesn't guarantee that we can use these resources properly in order to benefit ourselves. I think one of the factors that are involved in this fact is the term intrusion. A lot of people who are not trained in mental health, into psychology, into psychotherapy, or so on, can provide advices and give resources even when they are not trained, even when they are not prepared for giving advices. I think other factor that is keeping the problem unsolved is that people prefer following and listening other professionals that make them feel happier. If I listen someone that make me feel motivated, happier, it's like short-term gratification, like in short term I feel happy, but meanwhile I forgot my problems for a while. Why should I go to the therapist in order to know how my mind works, to learn how to listen to my body, to learn how my belief system works coming from the childhood and how these past traumas are dealing with the present, how communicate with the others and with myself. So why should I want this that is not pleasant if I can listen the other person that motivates me, that encourage me to do things, makes me happier, and I forget all the problems that they have? So of course people are choosing mostly this option. I think other factor that maintain this problem unsolved comes from the therapists themselves. A therapist shouldn't tell what person has to do or shouldn't do. This is not the goal of the therapy. And clarifying this concept can help to themselves as therapists and the patients in order to clarify the expectations that why I go to therapy, what is my final goal. When I go to therapy, indeed I go myself. I think every professional of mental health should receive mental health services. When I go to my therapist, I don't expect this person tell me what I have to do. This shouldn't be the main purpose. This person doesn't know about what I have to do. It's anyone to tell me what I should do, what I shouldn't do. If this happens, it would keep a relationship which is not balanced. The therapist is here and I'm here, and it's not the purpose. I think it's good opportunity to mention the Wadela concepts from biosynthesis, cure and care. A therapist's objective shouldn't be cure, but the patient cure themselves. The therapist, as professional, should care about the person, should listen in order to the patient listen themselves, should just be there, present, mindful, in order that the person see himself talking with the inner self, dealing with their emotions. The person, the patient, see himself looked by other person, which this person doesn't criticize him, doesn't judge him, just with a gazing that is totally compassionate, just is there. Doesn't matter how will be, just this person is there. If I pay a person that is called therapist, in order this person gives me advices and gives me, oh, I have to do this and this, I will become dependent of this person. I will create a symbiosis which I cannot live with this figure in my life. Like this, I don't learn how to make decisions by myself. This is not the goal. The objective of the therapy is that the patient lives their life without the figure of the therapist. I think the term here is related to openness, exposure to other person. I let myself be seen by other person. And this wouldn't be possible if the other person judged me all the time, tell me, oh, you have to do this, you have to do that. This doesn't happen. A person feels comfortable when have the feeling that no matter what I do, no matter what I say, the other person will be there. Will be there when I am bad and when I am progressing, I am developing myself. This is the real goal of therapy.